Good afternoon. Welcome to Health and Government Operations Committee. This is Friday, February 14th. We're doing voting list number 4. Is there a motion for the withdrawals? They've been moved and second. Any discussion? Any objection? All those in favor say aye. Aye. Any opposition? Seeing none, they've been withdrawn. Let's start with Lisa, House Bill 297, which is on the second page of the voting list. Maryland Health Benefit Exchange State-Based Young Adult Health Insurance Subsidies Pilot Program, Sunset Repeal. It came out of the subcommittee favorable with amendment, and it is Delegate Collison and the analyst Lisa. Lisa.
This bill renames the State-Based Young Adult Subsidy Pilot Program to be the State-Based Young Adult Health Insurance Subsidies Program and repeals the termination date. The amendments authorize rather than require the Maryland Health Benefit Exchange to establish and implement the program and prohibit the exchange from implementing the program if certain funds are not available.
Delegate Collison. Thank you, Lisa.
Thank you, Madam Chair. This is a program that that's been going on for about 4 years now. It's been very successful in getting young people the insurance they need, and having those young people in our insurance pool is a benefit to us all. The money is from the reinsurance fund. It's $20 million a year. It does not go up. And we allowed them last year to carry over money if it wasn't all used, but we'll see how that goes going forward. The vote in the committee was not unanimous. It was along the lines of ideological differences, but I would move the bill. I would move the amendment.
The amendments have been moved. Is there a discussion or question on the amendments? All those in favor say aye. Aye. Any opposition to the amendments? Seeing none, on the bill as amended.
Second.
The bill has been moved and second. Is there a question or discussion on the bill as amended? Seeing none, all those in favor say aye. Aye. Any opposition? Can you raise your hand? Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, Delegate Kipke. Thank you. Let's move on to, who does not want to be on the bill? Raise your hand. Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, and Delegate Kipke. Thank you. Thank you, Delegate. Let's move on to House Bill 424, Delegate Collison and White Holland, the Prescription Drug Affordability Board. It came out favorable with amendment. Lisa.
This bill repeals existing reporting requirements for the Prescription Drug Affordability Board regarding upper payment limits. Instead, the Prescription Drug Affordability Board must determine whether it is in the best interest of the state to expand its authority to set upper payment limits for purchases and payer reimbursements of prescription drug products in the state as specified. If the Prescription Drug Affordability Board makes this determination, it must establish a specified process and set upper payment limits in accordance with the process. The bill also authorizes the Prescription Drug Affordability Board to reconsider a UPL for a drug that becomes a current shortage, prohibits the board from taking specified actions that pertain to upper payment limits, modifies the requirements and criteria for setting upper payment limits, and repeals obsolete language related to the Prescription Drug Affordability Fund. The expansion of the upper payment limit authority is contingent on 2 upper payment limits being established under current law and in place for 1 year before September 30th, 2030. There are amendments that are on page 14 in your 14 of your packet. And they require the board to confer with Medicaid before setting upper payment limits that may impact Medicaid. They provide that the authority to set upper payment limits does not apply to purchases and payer reimbursements related to certain federal programs, and corrects a typo and makes the dates consistent for implementing the contingency.
Delegate Collison.
Thank you, Madam Chair. We've discussed this bill at length, and I appreciate the input that everyone has had. I want to be clear about a couple of things before we move forward. You know, we focus on the notion of upper payment limits. However, what you've heard from the executive, and if you listen to any of the board meetings, they are looking at all cost containment options available to them, including working with the manufacturers. Upper payment limits is just one possible tool. We talked a lot about the cost of pharmaceuticals and how much they affect the cost of our insurance premiums and in many cases our co-pays and co-insurances. By extending it to the commercial market, the impact will be on the premium paid by folks who are engaged or who are enrolled in the commercial market. And I need to remind you, because I know there's a lot of questions about whether or not we can trust those insurance folks, they are required by law to spend 20% or less of any premium dollar on administration, no more than that, which means if their costs go down, their premiums have to go down. So that's the way this bill affects on the commercial market and how it will be a direct benefit to consumers. In terms of the state bill, what the board is working on now, that has the authority to do state and local governments, those are self-funded programs. The way the benefit comes to the taxpayer is, I'm going to remind you, we are spending 40% of every dollar, whether it's a state tax dollar or a dollar that comes out of our pockets for premiums, on pharmaceuticals. And that cost has gone up over 15% in the last decade. We can't sustain this. We have to find a way to contain these costs. We wish the commercial market and the competitive market would have worked. It hasn't, and pharmaceutical costs are out of control. So and the amendments to this bill make sure that we are cognizant of the impact on Medicaid and also on the impact of federal programs. I think I can confidently say to you those would have been factored into the considerations of the board anyway, but the bill then requires it to do so. So with that, I move the amendments, Madam Chair.
Is there a second? Second. It's been moved and second. Any discussion on the amendments? Seeing none, all those in favor say aye. Aye. Any opposition to the amendments? Seeing none, on the bill as amended. It's been moved and second. Is there a discussion or question on the bill as amended? Delegate Morgan.
Thank you, Madam Chair.
My pleasure.
I want to say we appreciate the chair and the vice chair's constant pressure and looking after and making sure we can have affordable pharmaceutical sales. Myself, and I believe many others on this committee, or some others, not many, are going to vote no on this legislation over ideological differences that we believe the European-style price controls, such as upper payment limits, really have the potential of rationing medication that our constituents desperately need. So with that, thank you, Madam Chair.
Thank you for the consideration to the committee, and I want you to know that it matters, okay, and that we're grateful. Any other discussion? Seeing none, all those in favor say aye. Aye. Any objection? I have Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, Delegate Kipke. Thank you. And thank you to the committee, to everyone for your work, and to the team as well, the analyst. Any sponsor who does not want to be on the bill? Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, Delegate Kipke. All right, let's move on to House Bill 443, and that is baby food labeling. It came out favorable. It is Aaron and Bagno out of Public Health. Aaron.
House Bill 443 alters baby food labeling requirements to replace the phrase toxic heavy metal with toxic element on a tested baby food product. If the baby food has been tested for toxic heavy metals subject to the limits established by the FDA. The product label must say, for information about toxic element testing on this product, scan the QR code.
Move the bill.
It's been moved in second. Any questions or concerns? Seeing none, on the bill as amended, all those in favor?
There's no amendments.
I'm sorry, I'm sorry. On the bill, it was moved in second, right? So all those in favor say aye. Aye. Any opposition? The bill passes unanimous. Who does not want to be on the bill? We can't. Oh. Oh, it's favorable, all right. Oh, those. Okay. We can because it's favorable, okay.
I wouldn't.
Yeah, because if we amend it, it delays it. Okay, it's all right. All right, so let's move on to 468, but we're going to hold that bill. And let's move on to House Bill 565. It's favorable, and it is Lisa and Rosenberg.
This bill requires the State Board of Pharmacy to send renewal notices by email instead of by first-class mail. If requested, the board must instead send a renewal notice by first-class mail to the individual's last known address.
Delegate, it's been moved in second. Wonderful. Is there a question or discussion on it? Seeing none, all those in favor say aye. Aye. Any opposition? All right, and we cannot get on it because it's favorable. All right, let's move on, and I want to thank Lisa and Aaron for their hard work. Let's move on to House Bill and the committee chairs as well. Let's move on to House Bill 188. It is procurement, favorable, Lindsay and Kerr. Lindsay.
This bill prohibits any entity that is owned, operated, or controlled by specified governments from bidding on, submitting a proposal for, or entering into or renewing a contract with a public body in the state. To that end, by December 31st, 2025, the Board of Public Works must use credible information available to the public to create a list of entities barred from participating in procurement with a public body. The bill includes procedures for adding entities to and removing entities from the list maintained by BPW, and also includes penalties for making a false certification under the bill. There are no amendments.
Delegate Kerr.
This is a bill that we all unanimously supported last year. There was no discussion in subcommittee. I move the bill.
Second.
It's been moved in second. Any question or discussion? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none is unanimous, and because it was favorable, we cannot get on it. Let's move on, which is good. Let's move on to House Bill 209. It is favorable, Lindsay and Kerr, and it's state finance and procurement.
This is a departmental bill from DeWitt that repeals a duplicative requirement that each county government, local school system, and local health department, except for municipal governments, consult with the local emergency manager to create or update a cybersecurity preparedness and response plan and complete a cybersecurity preparedness assessment. There are no amendments.
Delegate Kerr.
There were no amendments. There's no concerns in subcommittee. I move the bill.
Second.
Moved in second. Any questions or discussion? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Let's move on to House Bill 221. It is Department of Information Technology. It is favorable, Lindsay and Kerr. Lindsay.
This is another DeWitt departmental bill that codifies the Maryland Digital Service within the Department of Information Technology as a centralized unit that collaborates with units of state government to support improved service delivery to Maryland residents and agency staff through user-centered design, software development, and product management best practices. Units of state government must collaborate with MDDS to ensure the alignment and funding of digital initiatives with the overall goal and priorities of the state consistent with the statewide information technology master plan. There are no amendments.
Delegate Kerr.
There was no concern in subcommittee. It was unanimous. I move the bill.
Second.
Moved in second. Any questions or discussion? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Let's move on to the next bill, which is House Bill 235, State Government Information Technology. Favorable with amendment. Lindsay and Kerr. Lindsay.
This is another Do It departmental bill that makes various clarifying and administrative changes to the state's regulatory framework governing state and local cybersecurity related to the responsibilities between Do It and MDEM, the Maryland Department of Emergency Management. There is an amendment on page 1 in your packet that restores a requirement that was previously struck in the bill, that the office report on the state's expenditure on cybersecurity relative to overall IT spending for the prior 3 years, and recommendations for changes to the budget to improve state and local cybersecurity preparedness. But it alters that reporting date from what in current law is December 31st of each year to be on or before the third Wednesday in January, except in a year with a newly elected governor when it is on or before the third Friday of January.
Delegate Kerr.
There were no concerns with the bill or the amendment. We moved the amended bill out of subcommittee, and I move the amendment.
It's been moved in second. Any questions or discussion? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes, is unanimous. Let's move on. Oh, yes, move the bill as amended. It's been moved and second. I'm sorry, I thought it was a favorable for a minute. So if it's been moved as amended, any questions or discussion on the bill as amended? All those in favor say aye. Aye. Any opposition? The bill passes. Let's move on to House Bill 284, Procurement Electronic Transaction, favorable. Lindsay and Kurt. Lindsay.
This is a departmental bill from MDOT that clarifies that only fees collected for the use of electronic procurement systems that are due to the state must be deposited in the Operations Revenue Fund. There are no amendments.
All right, Delegate Kurt.
There were no concerns in subcommittee. I move the bill.
Second.
All right, it's been moved and second. Any questions or discussion? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. This actually is that was the last bill for, oh, there's one more? Where is it? Oh, the second page. And, all right, so let's do it. That is House Bill 300, favorable with amendment. You know what? It was in between the other ones. Okay, Lindsay, go ahead.
This bill alters the rate at which a certain nonprofit organization receiving a state grant or contract is reimbursed for indirect costs from at least 10% to the de minimis rate established in specified federal regulations. Those are currently set at 15%. There's a reprint of the bill starting on page 11 in your packets. This reprint actually contains two different sets of amendments. The first set, adopted in subcommittee, make the bill an emergency bill, and also alters the reimbursement rate to the greater of the de minimis rate established in federal regulations, or 15%. There's also an incorporated reporting amendment suggested by the chair that is also appears at starting at the bottom of page 12. So do you want to handle those separately?
You can go ahead.
Okay, so the reporting requirement would require the Department of Budget and Management to examine the salaries of senior staff of the nonprofit organizations that are receiving this indirect cost reimbursement, the organization's administrative expenses, and if the organization was the recipient of a grant or contract prior to the bill's effective date, which is October 1st, 2025, a comparison of the indirect cost rate received before October 1st, 2025, and the rate that's received during the 3-year period that this study would be looking at, which is October 1st, 2025 to October 1st, 2028, and then requires DBM to report its findings December 1st, 2028.
And thank you, Lindsay, for capturing that amendment. We discussed it, and basically the reason for the amendment is that we want to make sure that, the money goes where, for the operation, not for the salaries, right? That there's some balance. Delegate Kurt, and Lindsay, thank you so much for working with us on it. Go ahead.
Yes, the emergency amendment was adopted in subcommittee. The other amendment came out of post-subcommittee discussions, but it did address some concerns that arose after the subcommittee met. I move the amendments.
Second. The amendments have been moved in second. Is there any discussion? I'm going to start with Delegate Chalega, then followed by Delegate Chisholm.
Why is the reporting date not until 28? So why are we waiting 3 years to hear back?
We're waiting 3 years because we did not want to overwhelm the Department of DBM, and it would be costly, the fiscal note. We didn't want to make sure, we wanted to make sure that it didn't have a huge fiscal note, and we thought that 3 years was a compromise, was a good number.
Can I add one other thing?
Yes.
I apologize. I also neglected to mention that this reporting applies to the recipient or subrecipient of a grant or contract that exceeds $1 million. So that also got it, trying to limit the scope of the study that they'd be doing.
And also because there's a lot of nonprofits in Maryland, and we don't, it's going to be overwhelming, and we thought that 3 years was a good compromise.
Is there a current report being done on all the nonprofits we're funding?
No, we don't know that.
Be nice if that report was sooner then, if we haven't been hearing from them. Would it be possible to make it 27, even back it up a year to see, what this is looking like?
Again, we do not want, the fiscal note came out and did not include this reporting. So it's going to go to the Senate, and I don't want to risk being taken out. So it's a compromise, so if you could trust my gut and my judgment on it, because otherwise it may be removed.
Some reporting's better than none, is that what you're saying?
Yes,
Thank
yes. Thank you. Delegate Chisholm, and thank you so much for working with us. Delegate Chisholm.
Just a quick question for clarification. It says the de minimis rate or 15%, whatever's greater, and the federal is already at 15%. Should I assume then that that means if the Fed de minimis rate goes up, that this will automatically go up with it? Is that why that's in there? Because obviously it's unnecessary at this point unless we're looking into the future.
So yes, if it went up, this would go up. The amendment changed, the original bill came in at the de minimis rate established in federal regulations. The or 15%, I think, contemplates the possibility that the federal rate could go down. And so it would be at least that 15% then. But yes, if it went above 15%, then it would go up.
So to not make it static, I'm assuming.
I'm sorry, I didn't.
To not make it static, so it's not always going to be set there, and it will move. It'll consistently be at 15%. I understand that part, but it also indicates that if it goes above the 15%, then it can go above the 15% as well. Okay. Thank you, Madam Chair.
Thank you for the questions. Delegate White-Holland.
Madam Chair, just very quickly, do we have a sense or an estimate about how many nonprofits would be included in this type of report?
No.
Okay.
You want to say anything, Delegate Carr? No. Okay, okay. All right, any questions or discussion? Oh, Delegate Riley.
Thank you, Madam Secretary. So
I have to look over there.
back here. So that just kind of lets, so we have a lot, you said there was a lot of nonprofits. So are the only ones that are going to be part of the reporting or the ones that are going to apply for grants, or everybody across the board, whether they apply for grants or not?
They have to have been a recipient or a subrecipient of a grant or contract, and it also has to be this particular section where they're getting this reimbursement of indirect costs rate.
Great, thank you.
So it doesn't capture, there's another portion here, if they've negotiated and received indirect costs under a direct federal award, that's not captured in the report. Again,
Okay.
trying to sort of narrow it as much as possible to what's affected by this bill now.
About that bill. Okay, thank you very much.
You're welcome. Any other questions or concerns? Okay, and again, the idea of that language was that there was concern that we want to, there's a lot of COs, right? They get paid really well, some do not. And we want to make sure that we know what percentage is going right towards the salary. Did they use the money to increase that salary, right? Not that they do it, I'm not saying they do it, but, you know, it was a concern that was brought up, so we're just trying to address it. And we actually decided $1 million just because then it won't apply to the little ones, right? And $1 million or more as well. Again, I don't even know that that will stay on the bill, okay? We're hoping that it stays across the street. It's a compromise.
That was my concern with moving it from 10 to 15%, because to the examples you're giving, because it's happened where we have these nonprofits, and then all of a sudden the CEO is taking a good portion of the money. And that was my concern, I think, in subcommittee, that because we're raising it, it doesn't mean that it's going to get applied equally across the nonprofit. It could go to one person because under indirect, salaries are included.
Right, but we won't know that until we get that report, right?
Yeah.
Because not everybody does it. We all know nonprofits, and I would say 99% of them are amazing, right? And the salaries are reasonable. But we want to see, what does it look like? So we need the data so that we can come back and do something.
Yeah, I agree with the report.
Yeah.
I just
Yeah.
was uncomfortable giving that bad
Yeah.
apple even greater flexibility to increase their own salary,
Yeah.
and nobody else gets affected, and they're not really providing a better service for whoever their initiative is built around.
Yeah, so this is a compromise, right? And thank you for the questions. I appreciate it, and for the concerns, and for trying to make it work. Really grateful. Any other discussion? All right, so this was actually favorable with amendments, so have been moved in seconds, and we have had the discussion. So all those in favor of the amendment say aye. Aye. Any opposition to the amendments? On the bill as amended? Move the bill as amended. It's been moved in second. Any discussion on the bill as amended? Delegate Shalega.
I'm going to support this bill, but if the Senate takes the reporting out, I'm a hard no on it. So, I think we need some accountability. We can't just up what the nonprofits are getting without putting some provisions in there. So,
Thank you.
Do good over there, please.
Any other points? Okay, all those in favor say aye. Aye. Any opposition? Say none. It is favorable with amendment. Who does not want to be on the bill? Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, Delegate Kipke. Everyone else will be a co-sponsor. And I believe that was the last bill, correct? So we are done with voting. We are going to come back for bill hearings at 1:15. I want to give time for people to have a little breakfast, because probably no one has eaten breakfast / lunch. And then if you could stay on your seat for a second so that we can do the bill assignments, okay?